Shortly after I finished my cardiology fellowship training, there was a tragic story in the news about a young woman who had died suddenly after an emotional shock. At the time, I wasn't sure what caused this, but many years later, I now realize that it's possible that this young woman died from a condition we call Takotsubo, or broken heart syndrome. Broken heart syndrome, where individuals have a heart attack, yet the problem is not the typical blocked artery, but an acute emotional or physical stressor, is one of the most fascinating and poorly understood problems in medicine. Before we get started, I will emphasize that this information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Doctors often look at the heart as a sophisticated pump. We see the valves and the physiology, but poets and romantics see the heart differently. They see the heart as the center of our emotions. The universal symbol of love is a heart. When someone faces a devastating loss, we say they are heartbroken. Which view is right? The condition of Takotsubo or broken heart suggests they both are. Takotsubo is a condition where an emotional or physical stressor leads to a heart attack. However, the arteries to the heart have no blockages. All of the signs of a heart attack are there, abnormal EKG and blood tests, and the heart function is often severely decreased, like in this example. So where did the unusual name of Takotsubo come from? It comes from Japan, where Takotsubo was first recognized, and it was because the heart typically looks like a takotsubo or an octopus pot, where the middle and tip of the heart isn't moving. However, we now know that there are several variations of impaired heart function, like this one, where the middle parts of the heart aren't contracting. We reported this variation in this paper in 2006. More rarely, the base of the heart isn't moving, like this example. And sometimes the right side of the heart is affected, as in this example. Adding to the confusion about Takotsubo is that it is called by many different names, including stress cardiomyopathy, transient ventricular ballooning syndrome, broken heart syndrome, apical ballooning syndrome, and ampulla cardiomyopathy. There have been many reported types of stress that has led to Takotsubo or broken heart, including medical procedures or illness, public speaking, surprise birthday parties, cocaine use, dobutamine stress test, lightning strikes, thyrotoxicosis, argument, bad news, and gambling losses have all been reported as causes of broken heart syndrome. The cause of broken heart syndrome is not clear. We now know that it's not a big artery problem like most causes of heart attacks. Clearly, there is some role for the large adrenaline and sympathetic nervous system surge that occurs with stress, and there is evidence of the central nervous system and endocrinology system being involved, but why it occurs in some people and at some times and not others is not known. So in summary, Takotsubo or broken heart syndrome is not uncommon. About 90% of those afflicted are women, mostly those who are postmenopausal. Recovery of heart function is necessary for the diagnoses, and recovery can take days or even months. Risk of recurrence if you've had Takotsubo is about 10%. Some experts think that long-term beta blockers can help lower that risk of reoccurrence, although this has not been proven in a research study. But for those who have had Takotsubo or broken heart syndrome, their long-term prognosis is the same as if they've never had it. Thanks for watching. If you like this video, hit the like button below, share it with your friends and family, and be sure to subscribe. I would love to connect with you on Facebook, Twitter, Pinterest, or Instagram, and you can join my Better Health community at toddhurstmd.com, where we talk about your better health, better life, and better weight loss.